Our next presenter is Dr. Johnny, who is a general surgeon in training at the Toowoomba Hospital, but he also is part-time with us here at CFM doing research under the Simple Hub. He has an interest in the research around hernia repair and has been working within CFM on the characteristics of the ideal hernia mesh and developing new and sustainable methods to find a solution to this challenging problem. So I will pass this over to Johnny. I'll also say that, so we have a lot of doctors up here on this list. Johnny is an actual MD, and so is Dr. Susie. So we've got a couple different varieties of doctor here today, which is exciting.
Yeah, fun mixed bag. Thank you, Molly. Thanks for that introduction. And it's my pleasure to actually be here. Thanks for joining everyone. So as Molly said, yes, I work part-time here at the university as a research fellow and also do some clinical work at the hospital as a principal house officer, which is basically just general surgeon training. So it's a pleasure to present the research that we've been doing on cellulose-based mesh materials for hernia repair. Also, can everyone hear me? Yes?
Yep, you're good.
Yeah, great, excellent. So hernia repair is a field that's evolved significantly over the last few decades, but it is a field that still faces some critical challenges, particularly with the types of repair that we perform. So in this presentation, I suppose I'll take you through a bit of the challenges and introduce the cellulose-based materials as a promising alternative that we've been looking into. First, I'd like to start with an acknowledgement of the country and acknowledge the traditional owners of this land on which we gather. I'd like to pay our respect to elders past, present, and emerging. So, hernias. Hernias, for those of you who don't know, I'll start off with a basic brief overview. Hernia is basically when an organ or tissue pushes through a weakened spot in the abdominal wall. So it is basically a hole or a defect within any part of the abdominal wall that can occur, as you can see, and you'll have anything from just a little bit of fat to nothing to bowel that can herniate through. So depending on the location, we classify them as inguinal, femoral, umbilical, incisional, but the ones that we'll be focusing on today are basically anything in the anterior abdominal wall or just anything that protrudes through your belly. Inguinal hernia is the most common. They account for about 75% of all cases. However, other types such as umbilical, incisional all present their own unique challenges and there's slight variations in how you go about approaching it. It's a very, very common condition. Globally, more than 20 million hernia repairs are performed every year, making it one of the most common surgical procedures. In Australia, we see over 60,000 elective procedures annually, and the rising prevalence of obesity in the population that we have tends to be making it an issue that is on the rise as well. So as you can see, the high volume of the procedures that are performed underscores the importance of effective and reliable repair techniques. And given the frequency and potential complications of hernias, the materials and methods used in the repair are of paramount importance. The hernias can come with a lot of complications. So they can range from completely asymptomatic to causing a life-threatening obstruction, whereby this bowel can actually protrude through, get trapped, and unable to get incarcerated essentially and unable to get back out, which can lead to the blood supply of the bowel being compromised and essentially that bit dying there, which results in a major bowel resection, which is a very big procedure. So you can imagine why hernia repair is quite important. So the gold standard for hernia repair is surgical intervention, and that's for good reason as well. So once a hernia forms, you can imagine it's a hole in the abdominal wall, and generally the body's quite good at repairing things, but with hernias, they tend to be holes that keep getting larger and larger. If you can imagine, if you do any sort of heavy lifting or the way that the abdominal wall moves around, it's often got a lot of abdominal pressure, which increases with obesity, which increases with work that does heavy lifting and things like that. And as you increase that abdominal pressure, you can imagine the hole that it creates getting bigger and bigger and bigger slowly over time. So once it forms, it rarely resolves without surgery, especially if it becomes symptomatic or grows in size. One of the most significant advancements in this field of hernia repair is the introduction of mesh reinforcement. So prior to mesh being introduced, you would open the hernia up and basically stitch the hole and bring to the edges of the hole together and just tie it up with some sutures. Now that was okay, but it came with problems of high rates of recurrence, where the sutures would fall apart under the tension and stress that the body had. So by placing a mesh over the weakened area, surgeons can strengthen the abdominal wall itself and reduce the risk of that recurrence. And non-mesh repairs where the defect is closed with sutures alone is still performed, however, in certain cases, especially in the context of severe infection or where putting a mesh in can actually cause more complications than the actual complication of recurrence, especially in larger or complex hernias as well. However, despite all this, the mesh is still the gold standard and the preferred approach, despite some of the challenges that they present, which we'll explore shortly. And just briefly, that you can do surgical repair via laparoscopic or open approach. Laparoscopic is basically keyhole surgery, which is where you go in just with very, very small cuts, approach the hernia either in the abdomen or just before you reach it and fix it that way. Otherwise, you can do an open repair where you just cut it straight down. Now, this is a rendered image. This is not a real image, but this is basically what you do is you cut a hole and you access the hole from that incision and fix it that way. Now, depending on surgeon preference, is usually what you prefer in terms of keyhole or open repair, but they both generally tend to have the same kind of favorable rates of recurrence and repair. Types of meshes. So synthetic meshes such as polypropylene and polyester have been widely used due to their mechanical strength and durability. And those are the ones that have really been tested in research. Now, synthetic meshes have undoubtedly improved the durability of hernia repairs compared to non-mesh repairs. They are not without their significant limitations. The most commonly used synthetic materials include polypropylene, polyester, or PTFE as well. So these materials offer excellent tensile strength and durability, but they can provoke some chronic inflammation and fibrosis. This is because the body often treats synthetic meshes or any synthetic thing that goes in the body as a foreign object triggering an immune response, which sometimes is preferable, sometimes not, and most of the time not. So over time, if you've got this foreign body in you, you can invoke this chronic inflammatory response, which can lead to things like chronic pain from the scar tissue, or adhesions, which are basically scar tissue that's built up inside the belly, and they can result in something called a bowel obstruction, where the scar tissue itself wraps itself around the bowel and constricts it. And you can even have mesh that erodes into surrounding tissues as well. Another issue is mesh shrinkage, where the mesh contracts after implantation, which not only reduces its coverage, but also can create tension, leading to discomfort and recurrence. So obviously you can tell that while synthetic meshes are great in terms of repair, they still have issues that we need to think about. Now, the next innovation in terms of meshes is biological meshes, which are derived from collagen-rich tissues, such as porcine dermis, bovine pericardium, or very rarely, I haven't personally seen it, but human dermis as well. These materials undergo extensive processing to remove the cellular components while preserving the extracellular matrix, which is basically a structure that's critical because it provides a scaffold that supports tissue integration and remodeling. Now, our bodies have its own extracellular matrix, which acts as our own internal scaffold for healing and our internal fibrosis to occur as well. Now, as you can imagine, one of the key advantages of biologic meshes is their excellent biocompatibility. They integrate well with the host tissue and are particularly useful in situations where the surgical field is contaminated or infected. Because if you have a contaminated or infected site, those are the types of sites where if you put a synthetic mesh in, they lead to increased inflammatory reaction because there's already a massive inflammatory reaction going on. So if you pop a foreign object in, then the body will just continue and exacerbate that inflammation and inflammatory reaction, which will lead to the mesh getting infected. And if the mesh gets infected, and you have to go back in and take it out. So biologic meshes, they tend to have a lower infection risk compared to synthetic meshes because of their biocompatibility. And they also promote tissue regeneration, facilitating neovascularization, which is basically growth of new blood vessels, and support the natural healing process. So they're designed to work with the body to allow the body to essentially repair itself using this mesh as a scaffold. So again, these are great, but they do come with some of their challenges associated with having biological meshes. They are far more expensive than our synthetic meshes, often limiting their widespread use, especially in regional hospitals and rural settings as well. And their longevity can also be unpredictable, particularly in high tension repairs. So these biologic meshes tend to degrade over time. However, some of them can degrade a bit too early, which might compromise their effectiveness. So if you think about it, if you've got a mesh there that's integrating well, but it degrades a bit too early, you still have an area of weakened abdominal wall that hasn't fully healed, and that increases the risk of hernia recurrence, which is why biological meshes tend to be not as effectively strong as synthetic meshes and have a higher rate of recurrence. And they lack the strength of permanent synthetic materials, especially in like high tension or high stress environments. And obesity is a common area that you can see this, where you've got a large abdominal wall, which is exerting a lot of stress and tension. You think about putting a synthetic mesh or a primary closure if it's an infected area. Now, let's consider the properties of an ideal hernia mesh. First and foremost, you can think about, there's a few things that a mesh needs. The first and foremost, you need tensile strength to withstand the intra-abdominal pressures exerted during daily activities like coughing, lifting, or even breathing. So if you think of your abdominal wall like a balloon, every time you lift something, it's a fixed space, right? Your abdominal wall is a fixed space. So imagine like a balloon inside a box. So every time you do some heavy lifting or you exert some sort of pressure on your abdomen, it's like blowing up that balloon inside that box. Now, the box is a fixed space, but if you're increasing the pressure, the balloon wants to try and get out. So you need a mesh that's able to withstand those abdominal pressures exerted. And in the literature and research, they suggest an ideal tensile strength range of about 16 to 32 newtons per centimeter. Now, obviously, this is also patient dependent, depending on how much body mass that they have and what kind of heavy lifting they're doing, all sorts of stuff. Now, another thing that's important apart from tensile strength is elasticity. So the mesh should mimic the natural flexibility of the abdominal wall, allowing for a smooth movement without discomfort. So your abdominal wall has a great range of movement, right? So it can flex, it can extend, it can twist, it can turn. Now, you need a mesh that is able to actually go along with these forces as well and be elastic enough to allow the natural flexibility of the abdominal wall without being stiff enough to cause any pain. So a good range that they suggest here is in the literature is about 20 to 35%. Now, pore size plays a vital role in tissue integration as well. So meshes need pores. The reason that they need pores is to promote vascularization and tissue ingrowth. The pores that are too large may compromise structural integrity, and pores that are too small don't promote vascularization. Again, the optimal pore size ranges between 1 to 3 millimeters, striking a balance between promoting cell migration and neovascularization. Now, the final thing that you think about, the final two things is a lightweight mesh, which is typically less than 50 grams per square meter, which helps them minimize the body's foreign body reaction and the risk of chronic pain and inflammation, as well as biocompatibility, because obviously you'd want something that's biocompatible and with the body. Now, let's get on to cellulose. So, given the limitations of the current meshes, researchers have been exploring alternative materials And one of those materials is cellulose, which is one of the most abundant biopolymers on the planet, found in cell walls of plants. It's renewable, biodegradable, and most importantly for our purposes, it's quite highly biocompatible, and it has been used in other medical research as well, and prone to be quite biocompatible. It provokes a much milder immune response compared to synthetic polymers. So this biocompatibility translates to reduced inflammation, better tissue integration, and fewer long-term complications. And moreover, using cellulose aligns with the broader push that we're seeing in healthcare towards sustainability and our circular economy, by reducing our reliance on petroleum-based products. Okie dokie. So cellulose exists in various forms, each with unique properties suited to different biomedical applications. The most basic form is native cellulose, which can offer some structural support but has limited flexibility. So cellulose can be processed into other forms, including nanocellulose, which we'll touch on a bit later, as well as oxidized cellulose, which is another variation where functional groups are added to the cellulose backbone, enhancing its bioactivity, making it particularly useful for improving tissue integration and minimizing adhesion formation. Now, to fully leverage the potential of cellulose in hernia, we use processing techniques. So I'll just go through this very quickly. So cellulose can be extracted from a variety of original sources, primarily agricultural crops, including cotton and hemp, as well as wood, which follows a top-down approach whereby you can pulp and refine this to remove the lignin and hemicellulose, which are byproducts that you don't want when you're refining cellulose, to result in a highly pure cellulose product ready for further processing. It can then be processed in a variety of different ways through dissolution or modification by esterification or etherification or oxidation to get these further chemical derivatives, which can then be either regenerated back into cellulose or used directly into commercial practice, or from there it can be electrospun into something called nanocellulose, which is the very much refined form, a very, very refined form of cellulose. Electrospinning is what we use for nanocellulose, which is something that you might have heard around if you've been around our Simple Hub, which is basically where you apply an electric field to the polymer solution. You can create ultra-fine fibers forming a mesh with a high surface area, which is ideal for promoting cell adhesion. Now, this bottom-up approach, bacterial cellulose, I'll talk about in a second. So one of the most exciting developments in hernia mesh is creation of composite meshes, which is where you combine cellulose with synthetic polymers. You can achieve a balance between mechanical strength and biocompatibility. So there's two main forms of meshes that are available on the market commercially. One of them is the Proceed mesh, which features a polypropylene core for structural support and an oxidized cellulose layer to enhance the biocompatibility. So the oxidized cellulose layer, so the polypropylene layer obviously acts as the backbone for structural integrity, and the oxidized cellulose layer acts as a barrier, reducing adhesion formation. So that layer faces the bowel, that layer faces the bit where it's getting integrated and reduces adhesion formation whilst promoting tissue integration. The similarly, Sepramesh is another one that incorporates a polypropylene base, but is coated with a bioresorbable, another cellulose derivative, which prevents direct contact between the mesh and surrounding tissue. So that one faces the bowel and it minimizes postoperative complications like the scar formation that I was talking about earlier by limiting the formation of those fibroses. Whereas if you had that direct contact between polypropylene and the bowels, you get a much more evoked inflammatory response to reaction. Now, bacterial cellulose. So bacterial cellulose, or bacterial nanocellulose, is synthesized by bacteria, specifically species like Gluconeceptobacter xylonis, during a controlled fermentation process, which again results in a highly pure form of cellulose that's free from lignin and hemicellulose, which are the impurities that you typically find in plant-derived cellulose. So one of the defining features of bacterial nanocellulose is its nanofibrillar structure, which closely mimics the extracellular matrix or ECM in the human tissue. This structural similarity provides an ideal environment for cell adhesion and proliferation, which are critical for tissue regeneration. So bacterial nanocellulose's physical and mechanical properties make it an excellent candidate for dynamic environments such as the abdominal wall. So it has a high tensile strength that can withstand mechanical stresses, while its flexibility allows it to conform to irregular anatomical surfaces. From a biological perspective, it excels in promoting tissue integration. And in preclinical studies that have already been done on rats, it shows that BNC meshes have been shown to support fibroblast adhesion and proliferation, which are key steps in the formation of new connective tissue. And it also encourages collagen synthesis, which strengthens the repair site. And again, in those rat models, it's shown that BNC-based meshes have demonstrated a lower incidence of adhesions, even in a contaminated field, which makes it particularly promising for high-risk populations. However, it's worth noting that whilst it holds a lot of promise, it's still very, very early in the terms of research, and no commercially available mesh is available just yet. And it has some issues in terms of production scalability and cost. Now, going on to some challenges. So the main challenges and advantages. The main advantages of cellulose-based meshes. One of the primary concerns for cellulose-based meshes is their mechanical strength, because we know that synthetic meshes have very, very strong, and which is why they're commonly used. BNC and other nanocellulose derivatives exhibit improved tensile strength compared to native cellulose. They may still not match the mechanical robustness of synthetic meshes like polypropylene in all scenarios. This limitation can be particularly problematic in cases of very large or hernias or abdominal wall defects where high mechanical load bearing is required. However, that doesn't say that in the majority of the population where you've got these average or normal sized hernias, that this could be something that could be used. Another critical issue is the degradation rate of these biodegradable meshes. So we know that they have increased biocompatibility, but there is no long-term studies that demonstrate the degradation rate of these kind of meshes as well. So ideally, the mesh should degrade in harmony with the body's natural tissue healing process. Obviously, as I said before, if the mesh degrades too quickly, it may lose structural integrity before the tissue has sufficiently regenerated, increasing the risk of recurrence. And conversely, if it's too slow, the mesh may persist longer than it's necessary, particularly leading to chronic inflammation or a prolonged foreign body reaction. On the manufacturing side of things, scalability remains a significant hurdle. So producing cellulose-based or nanocellulose-based products at the quality and quantity required for medical applications is quite labor-intensive and costly. Additionally, ensuring consistency across production methods is also challenging, which can lead to variability in the mesh's mechanical and biological properties. So regulatory approval can present a major challenge in that scenario. Again, the process to create a new mesh or a new biomedical product, as you'll probably understand, takes many years and requires significant financial investment as well. And furthermore, we currently lack the long-term clinical data to fully understand how these meshes perform over time, especially in human patients. And the other thing is, the great thing about humans in medicine is that the patients are very, very variable. There is no controlled environment, so patients can have lots of comorbid conditions like diabetes or lifestyle factors such as smoking, which affects wound healing and tissue integration. And to think about all of these scenarios and put them all in and try and control them is very, very difficult, especially in a research scenario. Now, I'll quickly touch on some innovations. So to overcome some of these challenges associated with cellulose-based meshes and to enhance their performance, there's been some research into functionalization techniques, which is basically modifying the base cellulose material to imbue it with some additional properties that can address specific clinical needs. One of the most exciting areas is you can actually incorporate antimicrobial agents into, I suppose, these meshes. So this has been already done in other biomedical applications, but postoperative infections remain a significant complication in hernia repair, and embedding some antimicrobial agents like silver or directly in antibiotics such as vancomycin directly into the mesh can theoretically provide a protective effect. Another promising functionalization strategy involves the use of growth factors. These factors stimulate angiogenesis, which is the formation of new blood vessels, which is crucial for supplying oxygen and nutrients to the healing tissue. And by promoting this faster, you can technically allow for more robust tissue integration quicker. And thus, if you've got a quicker rate of wound healing, then you don't need to rely on that mesh sticking around and causing all those kind of fibrotic complications either. Anti-adhesion coatings are already something that's available with those oxidized regenerated cellulose coatings, like in the Proceed mesh and Sepra mesh. The goal for this is to prevent fibrous connections to surrounding organs and reduce chronic pain and bowel obstruction. And hybridization, which is with bioabsorbable polymers such as PLA or PCL, is another method to improve the mechanical and degradation properties of cellulose. So by integrating the backbone of PLA or a structurally strong synthetic material, you could potentially blend cellulose into it to provide an optimal balance of strength, flexibility, while degrading it in a controlled manner that aligns with the healing process. And lastly, I'd like to touch on nanocellulose, which is basically the bulk of what I'm looking into here at Simple Hub. So nanocellulose is quite an extraordinary material. It's garnered significant attention, particularly in the last decade in the field of biomaterials. As I said before, it's derived from cellulose, but its nanoscale dimensions give it unique properties that set it apart from its larger cellulose counterpart. So nanocellulose comes in three forms based on the way that it's produced: nanofibrillated cellulose, cellulose nanocrystals, and bacterial nanocellulose. So we've already talked a bit about bacterial nanocellulose. So nanofibrillated cellulose, or NFC, consists of long, flexible fibers, making it ideal for applications requiring high tensile strength and flexibility. Cellulose nanocrystals, or CNCs, are short and rigid with a high degree of crystallinity, which provides exceptional mechanical strength. One of the most remarkable physical properties of nanocellulose is its high surface area and the tensile strength that it potentially could have. And these characteristics enhance its ability to interact with cells and biomolecules, which is particularly valuable in the biomedical field. It has a high strength to weight ratio with mechanical properties comparable to materials like they say Kevlar in certain configurations as well. And its flexibility and elasticity also make it suitable for use in dynamic environments such as the abdominal wall. It's highly biocompatible, supports cell adhesion, proliferation, differentiation, which is crucial for tissue regeneration, as we know already. And it's biodegradable and non-toxic. So beyond hernia repair, it already has a wide range of applications in healthcare. So in wound healing, it's used in dressings already that retain moisture and accelerate tissue repair. And it's also been looked into for research in drug delivery systems because of its high surface area and ability to form stable matrices, allowing for the controlled release of therapeutic drugs. It's also been looked at in tissue engineering as a scaffold for regenerating complex tissues such as skin, cartilage, and even bone. However, despite its many advantages, obviously, it's not without challenges. Optimizing its mechanical properties for large-scale applications largely remains an ongoing area of research. And it's very, very early into seeing how it actually works inside the abdomen or inside tissues, especially in hernia repair. And I don't think there has been much, apart from bacterial nanocellulose, I don't think there has been much research done into utilizing it or in hernia repair itself. So that's it from me. If obviously hernia repair is quite a big issue, and the search for the ideal mesh is a problem that's not going to be solved anytime soon. But by leveraging the properties of nanocellulose and knowing what we already know with the properties that we want, and potentially using the synthetic meshes and combining it with nanocellulose, we can hope to make some roadways into developing a hernia mesh that's biocompatible and useful and sticks around without promoting the complications that current meshes have. Thanks for your time. Happy to